Can we go ahead and get started by having you talk about how many cases of measles you currently have there in Knox County?
Hi, Tracy. Yeah, as of today, we do have 14 confirmed cases. Our initial case was identified on the 24th of March. Since that time, throughout our contact investigations, we identified 40 close contacts across the state of Ohio, 33 of which were identified residing within Knox County.
So it was 40 across the state, then it got down to like 30 or so in your county.
That's accurate.
Okay, and so that's why we've seen sort of the numbers jump, it seems almost exponentially.
That's correct. As we know, measles is highly contagious, especially for those that are unvaccinated.
And so could you talk about that? Is that what you're seeing in these cases? Are these mostly unvaccinated people? Did they travel out of the country? What can you tell us?
Yeah, so all 14 cases throughout the investigation have been determined that they have been unvaccinated. The international traveler was the primary source that started our investigation within our jurisdiction. So as we continue to monitor, it's imperative that we educate individuals the efficacy of MMR and the importance of protecting ourselves and our vulnerable populations, especially those that maybe have some additional chronic illnesses.
What else are you telling the community there in terms of how they can stay safe? We're hearing a lot of people don't want to get their children vaccinated. What are you doing? How much more challenging, I should say, is that making the work that you do at the Public Health Department?
Sure. Yeah. At the end of the day, it's individuals' right and their decisions to make that. And please understand that I fully respect that. However, all I can do is urge individuals to truly educate themselves through reliable sources, to speak with their primary care, their pediatricians, and come to their own conclusion. The MMR vaccine has been around for 60 plus years. And as we have seen over the duration of those years, is the efficacy of MMR. And it's very evident that the ability for us to combat measles in the manner that is most proactive and safest is to be vaccinated. So, is it a challenge, Tracy? Without a doubt, it is definitely a challenge. And social media platforms that are out there and misinformation that are being provided to these individuals, all I can do is encourage them to truly speak with their primary care providers and draw their own conclusions because it's evident. We have years and years of evidence to show the efficacy of this vaccine. And if we truly want to get out of these outbreaks, we have to do a better job collectively to increase our vaccination rates.
And I'm just wondering, is this your first time dealing with measles? Because for so long, many thought it was eradicated.
Sure. Yeah. No, unfortunately, Knox County had an outbreak back in 2014.
What are you talking about with your peers in surrounding counties? Because Knox County is sort of in a sweet spot or the heart of counties here in Ohio. In central Ohio, many people can drive through there.
Yeah, no, it's maintaining common operating picture, not just with our stakeholders locally, but with our community partners outside of Knox County to ensure that, if there's any potential contacts that are on the other side of a border, that we have those discussions. But the biggest thing is, Tracy, at the end of the day, we have the tools necessary for this not to be an ongoing threat in our community. And I can't stress that enough.
You seem really passionate about that. What else can you do to get the word out? Do you have your contact tracers out there, educators? What else are you all doing?
Yeah, so we're also working with other stakeholders in the community. We do have contacts with individuals in different areas that are populations that are difficult to get a hold of, especially in a rural community. And we're setting up points of distribution in those rural areas to ensure easy access to that vaccine and reliable sources in the community that don't necessarily have a title, and understanding that people trust them. And we continue to have those conversations and educate them so we can do our best to not only to spread accurate information, but to create an access to that vaccine or even medical care for that matter, right? it takes a village like anything else. So we definitely work outside of silos in Knox County. We leverage each other's resources.
I love that. I was struck by what you said, reliable sources who don't necessarily have a title. What do you mean? Who are those folks?
So all our first responders, community partners that maybe are just well known in their specific areas in the community that hold positions that are outside of the world of government, but people tend to follow and trust. And uh, you can kind of break some of those potential barriers by knowing that so and so and X part of the county, we've known them. They've been a family member in this community for decades, and you just try to bridge that communication that, hey, look, we're not forcing this on anyone. It is, hey, we want the best for you, your family, and for you to make the most informed decision possible, and we'll do whatever we can to make that a reality.
We know how contagious measles is, and I know that your news release said that these folks are in isolation. Um, what do you think that means in terms of kind of putting an end to this there in Knox County?
I'm pleased to say at this given point in time, with those contacts, we do have the area contained, but that information is only valid as the investigation that individuals are willing to bring the information forward. Maybe they're not wanting to be completely truthful, or come forward in regards to, oh, I had dinner at so and so's house and I don't want our friends, our family to have to quarantine or isolate depending on where they are. So there's only so much my team can do with the information that we have. So it is contained at this point in time, at least as of this morning, and we'll continue to monitor that hour by hour. But as you stated, the contagious component of this is that if you're unvaccinated, the likelihood of you contracting this virus, if exposed, is substantial.
So can you just, as we wrap this up, talk about how, when you think about how contagious it is, can you talk about how important you think it is to get the word out? In fact, talking with us so that we can also help get that word out?
Yeah, I guess for me, it's, our priority as a health district is the overall just health and safety of our community. By working together and following some recommendations that we're bringing forward, we can effectively control and be able to get out of this outbreak sooner rather than later. So again, I encourage you to come to the health department. We have providers on scene that can educate you, can have those discussions. Go to your trusted primary care physician. If you have a pediatrician, it's, as I started this conversation off, I just encourage individuals to find reliable sources to educate them to make the best decision they possibly can for them and their loved ones.
All right, Commissioner Green, thank you so much for talking with us today.